Let me take you through our guests joining us to tell us the repercussions of this. Dr. Anup Dhir, Senior Consultant, Cosmetic Surgeon at Apollo Hospital, Delhi, and former President, Indian Association of Aesthetic Plastic Surgery, joins us. Thanks very much, sir. If you give me your take on how people are so desperate to get some hair back, are willing to take treatments that are risky for them. Do you know of this that's happened in Punjab, that oil that has led to many of their health condition deteriorating, with people going blind with that oil?
Well, promising to grow hair by some treatment, that's a multi-billion-dollar industry all over the world. Every country, every continent has its own fixes how to achieve it. So, but the ultimate truth is that in male pattern baldness, ultimately you have to go in for hair transplant if you want good growth of hair, provided you have enough hair follicles the back of your head from where they can be transplanted. So people don't want to undergo surgery and they try all these so-called magic remedies, which are anyway banned under the law. There's a Magic Remedies Act in Indian statute, which is rarely followed, and nobody takes care of these quacks. There are civil surgeons and other health officials in every district in India, but they do not do anything to restrict these kind of quackery in the areas of their jurisdiction, unfortunately. And now, in this case particularly, they did not do any surgery. They just promised some kind of magic potion in which probably a lot of irritants were there. And some of the ingredients might have been causing allergy to few people. And once it went into their eyes, when they washed their hair, the damage was done. And I don't know how many, what is the level of damage to the eyes, but it's definitely due to the irritation of the oil. And it can't, ultimately, it can cause further infection also of the eyes. So these people have to be treated on SOS basis.
Doctor, a quick word if I can ask you, is hair transplant really feasible? Does it really have an effect? And I know this is an oil, but there's also transplant that happens rampantly. How far and how long does that stay? And should one go for it?
Transplant, according to the Medical Council of India, the transplant should be performed by plastic surgeons or dermatologists and nobody else. But there are many letters to that effect, but it is rarely followed. And there's a lot of quackery going on. I've seen dentists, ENT surgeons, and other surgeons trying to do hair transplant in their small clinics without any quality control. So this thing has to be stopped. Ultimately, the government job is to stop all this, what is happening. Hair transplant, as it is, very effective, provided you have enough follicles. If the follicles are there, it's like breaking your fixed deposit to shift the money into your savings bank, which is the front of your head. So it's quite effective, it's quite good, but ultimately it costs money, it costs a lot of care, and it costs a lot of maintenance as well. So that's why people want to go in for a quick fix, and they unfortunately land up in this kind of situation.
Dr. Anup Dhir, really appreciate your time for joining us and giving us your take.